This is Dr. James with Kids Central Pediatrics and HelpMommy.com. And today we're going to talk about the differences between ADD and ADHD. Both of these are problems with neurotransmitters, a lack of neurotransmitters connecting neurons together so that we have problems either suppressing activity or the ability to pay attention. So ADD is attention deficit disorder. ADHD is attention deficit with hyperactivity disorder. And they present different, and a lot of times they present at different times. ADHD is usually pretty easy to figure out. These kids usually show up very young. Now, they will have had symptoms before they're 5, but usually when they get in kindergarten and first grade, they start to cause problems. They just have problems maintaining the norms. They can't pay attention, they're fidgeting, they're moving, they can't keep their hands to themselves, they're touching people, they're too noisy, they interrupt, they like to talk, they're talking to everybody, they're getting in trouble for getting out of their seats, they're getting in trouble for not doing their work, they're getting in trouble for not paying attention, they're getting in trouble for emotional dysregulation, that they get upset when things happen, they're easy to cry, they're easy to get angry, they're more likely to do impulsive things, and it happens very young. So a lot of times these are going to show up very, very young. ADD kids, especially ones that are pretty smart, usually can delay this. You may not see stuff so much because they're not causing problems. They're not moving around so much. They're not so loud. A lot of times they just kind of look like they're daydreaming. But when they get into 3rd and 4th grade, when things start to become more complicated, when they're reading, it starts to become reading comprehension and there's hidden meanings. They're not really good about paying attention to that reading so much that you can find out all those hidden things. When it comes to math problems, all of a sudden we start doing word problems and we hide what the math problem is. Whereas before they were really good at math because it was fast. Now all of a sudden they start to have a problem. The other thing in 3rd grade is things start speeding up. In those first couple grades, there was so much repetition that if you didn't pay attention the 1st, 2nd, or 3rd time, maybe that 4th or 5th time all of a sudden you picked it up. But now we're going through multiplication and then division and then fractions. And if you didn't get one and didn't understand it, now you're going to have a lot of problems with something else. So that's usually where most of these kids show up. Now, do they all show up? No, because there's some kids that just don't get stressed out enough, that maybe school's easy, maybe they're a lot smarter than everybody else. And so they cruise through school and then they may get, diagnosed later in high school or college or even in adulthood. These people that go on longer, they start to have more problems, maybe not academically, but they start to have problems where they're impulsive. They can't stay in relationships. They can't keep jobs. A lot of times their life starts to get really bad, and so then they start to seek out treatments. The lucky ones are the ones that become addicted to caffeine and just treat themselves with copious amounts of coffee or sodas. The unlucky ones know they're hyper, and so they try to calm themselves down with downers or alcohol and become alcoholics or drug addicts, and this is definitely not good. And so we would prefer to get these kids treated because we know that they can cause problems in adulthood as well. When I'm talking to kids and parents and stuff, and they're coming in for problems, we do an assessment. It's called the Vanderbilt score. And what we're looking for is we're looking for similar symptoms in multiple different situations. So we like to see the same things occurring at home as at school. So, if you're having problems with attention, we want to see that problem with attention at home. It could present itself different ways. And I can't sit still and do my homework at school. At home, I'm very forgetful and I don't do the things mom says. If mom tells me 3 things, I might get 1 done or I might not get any done. But we start to see those very similar things. Same things with hyperactivity and stuff like that. That's happening in both places. If we have a case where it's not happening in both places, where we have a perfect good kid at school, but they're awful at home, then we have a parenting problem. On the other side, if we have a kid that's great at home, but they're having problems at school, then we may have an inexperienced teacher, or we may be teaching in a way that the child's just not figuring it out and they're not able to comprehend, and so we need to teach them a different way. And so when we're doing the assessment, you're trying to figure out all those things and trying to figure out the best way to treat that child. A lot of times this does require medication, and a lot of those medications are stimulants because we're increasing those neurotransmitters. There are some non-stimulant medications that we can try, and some of them work very well depending on the child. But all of the medicines have some side effects. So because of that, you always want to make sure that you get the bang for your buck, meaning that, if we're going to see some side effects, that the benefits that we get are much higher than that, because we don't want to be tweaking little bits and then have lots of side effects. Side effects of these medications can include weight loss, poor appetite, problems going to sleep, some emotional irregularity, things like that aren't necessarily great, especially if you're going to see little results. But if you can take a child that was failing school or having no friends, well, then that can make a huge difference. A lot of times when I'm talking to parents, I tell people there are 3 reasons why I would consider medicating a child. Number 1 is school failure, where they're not able to learn or not able to do well just because they can't pay attention or complete their work. The second one is social, where kids are not wanting to be their friends, or parents are not letting their kids be friends with your kid because they're always getting them in trouble. And the third one, and probably the most important, self-esteem, where I'm not doing well, and so now I think I'm dumb. Or I'm getting in trouble, and now I think I'm bad. And then that becomes a self-fulfilling prophecy where if I'm gonna be dumb, I'm not gonna try. If I'm gonna be bad, I'm gonna be really, really bad. And that's definitely not what we wanna do. So if you're seeing any of those problems where your child's having problems focusing, they're having problems paying attention, they're having problems in school, they're getting in trouble, definitely seek out your pediatric provider. A lot of them are perfectly qualified to assess ADD and ADHD. A lot of them treat them and can treat them. If they don't feel comfortable treating them or assessing them, then seek out help in other places. Ask them where they should go to get assessed and to get properly treated so that your child can have every chance of success. Are there non-medication ways that you can treat it? Absolutely, and we should always try those. But your provider will be able to lead you in the right way. So if you have any of these questions, please, if you're one of our patients, contact us. But if you're someplace else, definitely contact your provider.